Hello all the dignitaries and today's attendance to today's webinar. आज का जो टॉपिक है वो बहुत ही इंटरेस्टिंग है. The reason behind we homeopath want to treat acute emergencies, but we don't have a proper guideline how to treat it, when to treat it, and what are the protocols we have to follow. So for that, Dr. Krupali has made a great effort to ask Dr. Sharon to be a part and speaker of today's topic so that we can learn a lot in our daily routine practice. So before I hand over the whole platform to Dr. Sharon, who is the renowned homeopath of India as well as globally, I would like to welcome Dr. Mona ma'am and Dr. Krupali. Talking about them, Dr. Mona ma'am is a secretary of National Homeopathic Medical Association of India, and Dr. Krupali is a general secretary of State Homeopathic Medical Association of India. So I hand over this platform to Dr. Krupali. So introduce other members and please let us know about today's topic. Yes, Dr. Krupali.
Yes, I welcome all of you on behalf of Gujarat State HMAI TD's wing. Thank you so much, all of you, for joining us. As you all know, every time our efforts are such to have enriched you with the knowledge. So this time also we have came up with a very renowned practitioner of our India and also globally, Dr. Sharon Ali. I welcome you, ma'am, Dr. Sharon Ali, ma'am. And without any expectation, you shown the readiness for this lecture. I'm very grateful for that. Thank you so much, ma'am, for that. I also welcome Dr. Dr. our very own Dr. Mona Kapadia, ma'am. Thank you so much, ma'am, for joining us. We will wait what else you are bringing up with us. Thank you so much, ma'am, for joining. Now, I will request Dr. Mona, ma'am, for your speech.
Mona ma'am, please unmute yourself before you speak. Please unmute. Yes, you are unmute now. You can speak.
Good afternoon, friends. Friends, National Wing બનાવવાનો આપણો હેતુ એ છે કે આપણે બધા સાથે મળીને સાથે વર્ક કરી શકીએ. દરેક સ્ટેટની અંદર ફિમેલ ડોક્ટર્સ આગળ આવી શકે અને એકબીજાને હેલ્પ કરી શકે. તો સૌથી પહેલા તમારે કામ એ જ કરવાનું છે, એક વોટ્સઅપ ગ્રુપ બનાવવાનું છે. 3-4 ફ્રેન્ડ્સથી પણ બનાવશું તો પણ ચાલશે અને એમાં એકબીજાને હેલ્પ કરવાની છે. સેકન્ડ, તમારે HMI ના મેમ્બર બનવાનું છે અને એ મેમ્બર બની એમાં લેડીઝ વિંગ બનાવીને એક્ટિવ થવાનું છે. આના કારણે આપણે સ્ટેટ થી નેશનલ સુધી એકબીજા સાથે કનેક્ટ રહીશું અને એક્ટિવ રહી શકીશું અને કોઈ પણ ડિફિકલ્ટી હોય તો તમે એકબીજાને હેલ્પ કરી શકો છો. તો આ રીતે નેશનલ વિંગની રચના કરીશું અને એકબીજાને સપોર્ટ કરીને હોમિયોપેથીમાં પ્રગતિના પંથે આપણે સૌ આગળ વધીશું. તો હું કૃપાલીને થેન્ક્સ કહેવા માંગીશ ગુજરાત સ્ટેટ કન્વીનર તરીકે. વેરી નાઇસ ડોક્ટર વર્ષા, બહુ સરસ આપણે એન્કરિંગ કરો છો અને મોસ્ટ ઓફ ડોક્ટર શેરન ને હું વેલકમ કરીશ અને થેન્ક્સ કહીશ. તો ફ્રેન્ડ્સ, આપણે સાથે મળીને આ રીતે પ્રગતિ કરતા રહીશું અને આગળ વધતા રહીશું એવી આશા રાખું છું. થેન્ક યુ સો મચ.
થેન્ક યુ. યસ, ડોક્ટર Krupali.
Now I request you, Dr. Varsha, to give introduction of our speaker.
Yes. So talking about today's topic and today's speaker, I'm very excited to host her because I'm a big fan of Dr. Sharon. I have been following her since long on Instagram and I was planning to call you on my channel, but luckily I got a chance through the HMAI to host you today. Dr. Sharon has a very great insight about the homeopathy. As I know, she has been trained by the legends of homeopaths like Dr. Shurimal Sarkar, Dr. Gajanan Dhanepkar, and Ashok Borkar sir. All the 3 years, my favorite homeopaths around the world. And I usually follow them through their webinars. And I actually owe them for whatever they do about the homeopathy. So today, I'm very excited to introduce you. Ma'am, as a homeopath. She has recognized across the world globally. And you will be very surprised to know ma'am has an experience of more than 20 years on the field of homeopathy, not only about the chronic diseases and the difficult cases, but she has an expertise by treating the acute emergency cases in homeopathy. And she has been trained by great legend homeopaths. As I told about Dr. Sarkar, you all know he is very expert and he is a great observer. Even Dr. Dhanipkar sir, he has made a great effort in talking about the results of homeopathy in the difficult cases like thyroid, PCOS, and acute emergencies. And Dr. Borkar sir, who has made great efforts in diabetes and other autoimmune disorders. So as an all, today we are going to get a great filters from all different legions, and plus ma'am's knowledge, who will let us know how homeopathy works in such type of difficult cases where we actually becomes very what we call, we become like कुएं का मेंढक जैसा बन जाते हैं ना, कि नाउ व्हाट वी हैव टू डू, अभी ये इतना प्रॉब्लम आ गया है, ये एक्यूट इमरजेंसी आ गई, इसको एलोपैथ के पास भेजें या होम्योपैथिक से ही ट्रीट करेंगे। तो आज हम मैम के नॉलेज से ये जरूर जानेंगे कि होम्योपैथिक किस हद तक एक्यूट इमरजेंसी में काम कर सकती है। इफ यू again, I would say ma'am has treated more than thousands of patients in this 20 years of her experience, and we are very happy to know that she has been called as a speaker in the UK Health Radio. That's a great dignity, ma'am. Usually we feel like कोई हमें यहाँ platform पे बुला लेगा तो भी हम खुश हैं. You have been called by UK Health Radio, and she has been invited by them, and she was a speaker on that platform. So I welcome Dr. Sharon.
Thank you very much.
And ma'am, I would request you to join your screen now. Additionally, I would add that Dr. Ma'am has an Heal Academy as well. And she has been teaching a lot of students and early practitioners as well. She has a great followers on Instagram. One of the follower is me, as well as she is running one WhatsApp group as well, where you can discuss your cases with the ma'am. So if you want to join, let us know, then we'll guide you how to join that. So these are few short introduction about the great personality in homeopathy. So ma'am, the whole platform is with you. If you have any doubt, any problems, let us know.
No, thank you so much. It's been, you have really edified me. I am just like y'all. I was very impressed by Dr. Tapadia's hope, which resonates with me, because I'm a lady and I have 3 daughters, and I know what it takes for a woman to run a clinic and take care of a home and be successful and do everything and be a good mother and be a good doctor and be everything. So I didn't come with this intent here, but then I heard this and I thought, yes, really, that's true. You know, we should really support each other, and we should really, you know, be there behind each other and say, okay, don't worry, what do you want? Shall tell me and I will help you. And what is it that, where are we getting stuck? Or if I'm in trouble, I should be able to have my own village or my own team where I can go and say, I'm stuck here, you know, I'm not getting it. And then someone else might say, you know, I saw a case like this, and that was treated like this, or, you know, this was what this teacher said. And maybe we'll get an entry point into our issues or our problems. So that I thought was something which I will take away right now from this meeting with all of y'all. Yeah, so and Dr. Krupali, thank you very much for this platform. Yes, we had a very short stint, but then I felt that I don't know, I connected, and I was like, yeah, she is a good person to get in touch with, and yeah, why not, you know? So thank you very much for this platform. Thank you very much, all of you.
Thank you so much, ma'am, for such a kind words.
I really hope you all benefit from this time you all are spending, this investment of time with me.
This is the quality which, you know, makes you different from others, you know, our legends and, or not legends, but not other homeopaths. that each and every minute you spend to help people. I have witnessed that process. No, in our group, if anyone asks even a simple questions, ma'am is always there to help and always ready to show her expertise or share her clinical knowledge. So it is a great quality of you, ma'am. Let me tell you that.
No, no,
Thank you
no,
so
no,
much.
no, 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 no. I am sure all of y'all are like that. The reason y'all are like this is because of why y'all are here, because y'all have come up and tried to create a platform of help. I don't think we're any different, not at all. No, we're all the same in our own circles, and we're going to now make both these merge, and we're going to help each other even more. We're going to be a bigger support system. So should I start?
The whole platform is with you. You can start, and if you want any help, then I'm always
Just
here.
a minute.
Yes,
આપણે
ma'am.
અંકુરભાઈનું સ્વાગત કરીએ છીએ. ગુજરાત સ્ટેટ સેક્રેટરી અહીંયા આપણી સામે હાજર છે. તો આપણે ગુજરાત સ્ટેટ ફિમેલ વિંગ તરફથી એમનું હાર્દિક સ્વાગત કરીએ છીએ.
Yes.
અંકુરભાઈ દેસાઈ.
Okay, so when I began planning this acute seminar, I was actually doing a seminar for fevers, and I thought, okay, I can do emergencies, I can do fevers, and then maybe I can go into other acutes. So the first part is my presentation on fevers, and then I will be teaching you on certain emergency remedies that we can have in our house or in our clinic, which you can keep with you, so that if there is an emergency, you know what to take homeopathically. Okay, so there'll be an emergency kit which you can make after this seminar. There'll be the acutes of fever, which I will be discussing from my ways, and there will be, after that, let's see if we have time after the question answer session. There are some other things I've kept in this, but then I really don't know. Let's see how time permits. Okay. I'm going to start this particular webinar with mentioning that this is where I learned most of how to deal with acutes. Okay, so Dr. Dhanapkar and his conquering fevers with homeopathy was the one thing, that was one guideline which I learned, and which really helped me understand how to deal with acutes. But of course, this is not the only acute. Fever is not the only acute, and but if you study conquering fevers, I'm sure you'll be able to deal with other acutes, because they're very similar. The methodology, if you get the link of how to think, you will be able to understand how to use each particular bit and twist it a little, twist it a little for, say, suppose a patient comes with bleeding, or say, suppose a patient comes with acute abdominal pain. How are we going to twist it a little to understand how to use it is what you will get. But I have to, because this is where I'm getting all my knowledge from, I give the credit to Dr. Dhanapkar and what he has taught me. Now, I'm going to go very fast through the physiology of fever, because I'm sure all of you all know it, but then let me just go through it. Fever, what is fever? Fever is a hyperthermic reaction to a response. Is it something that says it's not good or it's not bad? Nothing that says that. It's a hyperthermic reaction to a response. It is an elevation of body temperature that exceeds the normal daily variation in conjunction with an increase in the hypothalamic set point. Okay, so what do we usually see fevers with in homeopathy? We see fever as a immune response to a particular thing. Okay, it is a response. And what does the body do? It elevates the temperature. And this, we know what is the basic variation. So we have it over here, morning 98.9 Fahrenheit and evening little higher, 99.9 Fahrenheit. So if a patient comes to me in the evening and says, "Doctor, 100 fever," will I worry? I'll say, no, we'll wait and watch. This patient might go into fever, might not go into fever. Okay, because that is a normal variation. Okay. this is an important thing. When do we not treat fevers? When do we not treat fevers? When the appetite, stool, sleep, the generals are good. If the patient is saying, doctor, I have a fever, but my appetite is good, or my sleep is good, and my stools are coming, yeah, urine, no problem at all, nothing. Then I'll say, wait and watch. Let us see where this fever is going, because you will need more symptoms to prescribe. Of course, you can prescribe on the fever itself, but if it is not very high, if it is only 100, 100.4, I will not treat the patient if the fever is just coming in. Okay, I will tell them, go home, rest, eat good food, and just relax for some time. Call me up after 6 hours or 8 hours, or call me up the next morning and let me know how the night went. I will not treat this. Okay, if the fever is not chronic and there is no weight loss, then this comes. If the fever is coming every evening, 99.9, but every evening the patient is feeling feverish and is getting 100 fever, we will think about that. Okay, if the patient has good energy levels, eating well, sleeping well, we won't. What will we do till then? Just follow their diet, rehydrate them, and make them rest. If necessary, cold compresses. When do we go on high alert? This is something I want to share with you, because I have treated a lot of patients of fever above 104. Okay, but I will not suggest a newcomer who is not very confident about their prescriptions to even try this. Okay, please, first you start treating fevers up to 104, and if it is above 104, you need to take help from either someone who can deal with this kind of a prescription, or don't take up the case. Don't take too much of a risk. Take a calculated risk. How much can you take with a patient is what you have to decide according to your knowledge and your expertise. Do not take a uncalculated risk. If the fever is prolonged, if there are patients who have come to me who say, doctor, I've got fever, and then after, when I come to know, this is the 7th day or 8th day of fever, no, then we know that this is not going to go with the regular prescriptions. It will not go with belladonna for sure. Okay, so if the fever is prolonged, if there is weight loss with the fever, if the patient has a toxic look, what is a toxic look? This webinars are actually difficult because we don't see the face of the patient, the students. Okay, so what's a toxic look? A toxic look is when the patient has got is looking drowsy.
Do you want others to speak in between so that I can allow them? Their interaction?
Even if, no, I don't want them to speak, but that will become too difficult. But if I can see their faces, I will know, मतलब चेहरे से पता चलेगा कि उनको समझ में आ रहा है कि नहीं, you know. And I will also know whether they have to go slower or faster in what particular, you know, like in a particular thing, because I am still not sure whether I'm talking to students or practitioners.
Okay, please on your cameras. The speaker want to see each and every face. Please,
I can see your face and I can know whether you're understanding or no.
Yes, just a minute. Let me allow them. Please on your cameras, everyone, so that the speaker can know that you are understanding the thing or not.
Yeah, चेहरे से दिखता है, अरे नहीं समझ में आ रहा है और समझ में आ रहा है, whatever. So let me just see what. Thank you.
Yes, ma'am.
Hello, everyone. Now I feel as I'm teaching someone. I was thinking I'm talking on the.
Okay.
Yes. Oh, they won't get to see this then. They won't get to see this. It's okay. Okay. So I can see all of you all. Perfect. So if the fever is above 104, if the fever is too prolonged, if it is associated with weight loss, if the patient has a toxic look, if the face is looking oily and the drowsy and the patient is not being able to open the eyes, if there is, you know, the swords on the teeth where there is that layer over the teeth, the lips are cracked and dry. Okay, so we see all this in toxic fevers, and the moment you see that, if you see from the look that the patient is not really doing well, be careful about picking up the case. Okay, take it with a pinch of salt. Everything will not come on, acha ye hai, ye hai, ye hai, ye hai. Aisa nahi aata hai. You have to be able to look at the patient and decide whether this is a case which you can handle or not handle. Okay, if the SpO2 parameters are dropping below 95, now I've treated up to 46 also, but then again, as I'm saying, this is going to come over a period of time. You have to know that you can handle this case. The patient will not become a medical legal issue with you. Okay, so you have to take the risk calculated. Pulse rate too high and too low. Why do I say this? Pulse rate too high and too low will tell me if the patient is going into septicemia. So if the patient does not improve with pyrogen, which we know, right? We know that pyrogen helps in septicemic cases. If the pulse rate is too high, too low, and is not improving with pyrogen, please don't pick up the case. Please refer it out. Okay. This also means that you have to check everyone's pulse when they come inside. I lost a patient in COVID. She was, of course, admitted in the hospital and she was on the ventilator. But I lost a patient to COVID because in the hospital, they didn't realize the temperature was dropping. They had not done a temperature check on the patient when the patient's temperature was dropping. The pulse rate was normal, but the temperature dropped. Okay, so how are we going to find this out? Only by checking the pulse and temperature together. If you're going to only check the pulse, or if you're going to check only the temperature, then you are not taking a complete picture of the acute. Okay, if the patient is dehydrated and the urine output is reduced considerably, if the patient has any chronic underlying diseases of the heart, brain, or diabetes. See, diabetic cases, if they come in fever, no, and if they're not improving in the first set of prescriptions, like say, suppose a diabetic is having, I'm talking about insulin-dependent diabetes, or diabetes which has not been controlled properly. If they're coming to you and they're coming to you for diarrhea, for example, the case can deteriorate. So in such cases, unless you are capable of doing it, be careful. Okay. And if the patient has got a deranged sensorium, we get very happy, huh? Deranged sensorium. We have so many remedies in homeopathy, but you have to know you're picking up a case which is difficult. Okay. And you have to have a plan B. That if this patient itna time mein theek nahi hua, then I'm going to do this, or I'm going to send him to this doctor, or I'm going to call up this doctor and ask for help, or whatever. Okay. So these are the things that you're going to do when you go on high alert. High alert, I say this because some people can treat such patients, some people can't. And it really depends on your experience level. Febrile convulsions. We are all worried about this. But most of them, 20% of all children from the age of 6 months to 5 years will suffer from this. Most of the cases don't have complaints after that. Okay. The fits last from few seconds to few minutes. This may happen in underdeveloped. So I have seen in the autistic cases that we're seeing in Bal Kalyans and some, most of them did have febrile convulsions. But let me tell you, most of them had underlying issues before that. So we will have a few cases which are already having mental issues or physical retardation or mental retardation who do suffer from febrile convulsions. But having a febrile convulsion does not indicate anything else. Okay. So of course we know this, that epileptic fits during convulsions, the fits may last few seconds and the child may have stiffness, jerking, twitching, heavy breathing from mouth, blueness of face and loss of consciousness. Right now, if this happens in the clinic, the best remedy is belladonna. I think we all know this. Okay. If it is fever with febrile convulsions. What do you advise the patient? Remember that most febrile convulsions are self-limiting. So is it something to worry about? No. The only thing you have to worry is now what remedy to give, but you don't have to worry about picking up the case. Okay. Keep the patient in a safe place where the episode, for the episode to finish. Give some open air, loosen the garments, and turn the child's head to one side to avoid choking. That's it. If you do this and you tell the patient, keep the child on the dining table or keep the child on the bed or wherever, they will not get hurt while they are in convulsion, that is good enough. I've given you the differential diagnosis for febrile convulsions. How will we know it's falciparum malaria? In the clinic, look for icterus. Okay, simple. Meningitis, neck stiffness. Pneumonia, you're going to see it with the stethoscope. Septicemia, you're going to see it with the pulse. Upper respiratory tract infections, again, you're going to see it with the stetho. Worms, you're going to ask in the history. So now when you see a patient with febrile convulsions, what are you going to do? Simple. Icterus, then neck stiffness, check with the chest, check the pulse, and ask for history of worms. Simple? Okay? Okay. Now, I've said all this so you all know how important this is. Importance of clinical knowledge. Okay? So when I'm taking an acute, any acute, my head is always on the pathology, the physiology, and I'm always thinking what exactly is happening inside. If I can't understand that, I'm not sure about my prescription. Okay? So, for example, recurrent cough with a family history of TB may make us miss a possible case of TB. Okay? Diabetics may need more medication if they come with recurrent UTIs. Okay? What condition the patient is living in. We don't ask this, you know, patre ke ghar mein ho, is your house near a nala? Where exactly are you living? Under what conditions? Do you sleep on the floor? There was a patient in who had fever. Their their water tank is below the floor and they sleep on top of it. The patient got better with rhododendron. So the idea is you have to ask maybe a little more and find out the living conditions. If you're not getting better, then these are the things that you have to also ask. Or candida infections in the mouth can be missed. Because this, why I'm saying is because this is why we do physical examinations. You have to look inside the throat. You have to do a temperature check. You have to do a pulse check. You have to do the examination of the chest and abdomen, and urinary ke liye, you have to check the urethra. In small kids, they don't complain of burning. They will say stomach pain. They will not complain of burning in urination unless it's very bad, and then they say, the moment they come out of the washroom, they cry, and or when they're going for washroom, they cry. But most of them complain of pain in the abdomen. So we have to examine the urethra in pain of abdomen. Okay. Worm infestations and amoebiasis in patients who take antacids very freely. Okay. So this is important for us. Worm infestations and amoebiasis. So when a patient is taking antacids and then complains of stomach pain, what are we going to think? We think of acidity only. Do we think of amoebiasis? Do we think of worms? We have to. They've reduced the acids in their stomach. The worms can freely come inside. Okay. So what are the things we'll do? Now I'm putting this down so that everyone knows that these are the things that you have to do. The moment the patient enters, what are we going to do? Clinical examination. Besides taking it, you have to first of all know the underlying chronic case. I don't usually take acutes of a person who's not already my patient, because I have had these things. See, I don't know how well-versed you all are, but then as you become more and more good at your practice, and as you grow and you become a little more successful, you'll get more and more difficult cases, and then the patients also take a added risk, and they come to you for anything, like just literally anything, and if you are not safe medical legally, you are going to really mess yourself up. Okay, so here when I'm talking about this, if you don't know the chronic conditions of the patient and you're treating with homeopathy, I think that's a big risk you're taking. Okay. So what are we going to do? We're going to measure the temperature. We're going to check them. Don't check only with hand and then say, ha, garam hai, thanda hai, sar garam hai, pet garam hai. No, 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 no. Check with temperature, check with the thermometer, know what number comes and keep that. Okay. Check the pulse, and the pulse should always be done at the same time with the temperature checking, so that you can correlate that and see if the patient is needing pyrogen or baptisia or a remedy which is showing a depressed or bradycardia in high temperature. Okay. Then check eyes, nose, look for rashes, auscultate the respiratory sounds, check the abdomen, auscultate the abdomen, neck stiffness in children, check for sinuses. Okay. When you do this, the patient automatically gets confidence that this doctor is checking me up and I will be fine. They are taking care of me. So this also improves the doctor-patient relationship. Okay. Rheumatic fevers also has reduced pulse. In which cases do we have rheumatic fever with decreased pulse? We see it in Kalmia. Kalmia usually has a dichromatic pulse with rheumatism. Okay. COVID, every time COVID, no, I'm fine. Then when you check with the pulse oximeter, it shows a different reading. So now COVID has not gone completely. We do get patients that are like this. Okay. There was a case I had of pneumonia, where pneumonia came in the X-ray. The patient did not cough at all. Zero cough. Respiratory sounds were there only on auscultation. When we did the X-ray, it was full. There's only one remedy in the repertory. It is Sabadilla. So Sabadilla cured that case. But for me, the learning of that case was that not all pneumonia patients cough. Okay. So please auscultate your patients when they come with fever. Other causes of fever. Now this is again, why do we do this? Especially if we get a case which we don't know of, please tick this off. Whether the patient has gout. Yeah, my pen is not working. This pen is not working. Gout, porphyria, acidosis, dehydration. Okay. Here I've written all the causes which are also there for fever, like you have your influenza. Now this again, usually when a patient comes to us, we are thinking what are the most common causes and we're treating for the most common causes. We don't go into these things, right? Normally they're going to come what for sardi khansi, are viral hua hai, bryonia dena hai, ya viral hua hai, rustox dena hai, ya rhododendron dena hai, dalkamara dena hai, whatever. This is only for the first 5 or 7 years of your experience or your practice. Afterwards, you get all this also. Okay, be ready for it. So meningitis, endocarditis, kaise check karoge? Petechial patches under the fingers. Okay, respiratory upper respiratory tract, lower respiratory tract, including TB, malaria, filariasis, septicemia, UTI, GI infections, amoebic liver abscess, and acute hemolytic crisis. Certain cancers can also have fever, and lymphoproliferative malignancies like carcinoma of pancreas, lung, and bone hepatoma. Vascular causes. Please, these are ones that come to us. Myocardial infarction. So that means if a patient comes to us with respiratory distress and fever, what are we supposed to do? Check their BP, check their pulse. If that is not normal, if the pulse is not normal, please do the CPK test, MB and troponin. Okay, so if the patient has got a past history or a family history of myocardial infarct or coronary artery disease, and the patient comes to us in a state of fever with respiratory distress and sweating, then please don't look for any other symptoms, check them for this. Pulmonary embolism, spontaneous hemorrhages, all this we will see if we check the eyes. Okay, we will see the petechial patches, we will see whether the patient is having dilated pupils or constricted pupils, and we will know these things. So these are all things that can be examined clinically. Will we have to send them for an MRI first? No, just do a proper clinical examination. Okay, drug fevers, collagen diseases. So rheumatoid arthritis, we see a lot of patients who we say na ki they got this arthritis after chikungunya or dengue. It may not be chikungunya and dengue. It may be rheumatoid arthritis, because rheumatoid arthritis has fevers. Collagen diseases have fever. SLE has fever. So maybe you missed it. Maybe you thought it was chikungunya or dengue or whatever. So what are we supposed to do? Everything I say has what are we supposed to do? Okay, every single thing I say. So here, what are we going to do? Check RA factor, ASO titer. Okay, and drug fevers, like patients who have chemo, post-vaccination. So post-vaccination also, huh? So post-vaccination, we have children who come to us and they tell us about the fever, but they forget to tell us about the vaccination. So in these cases, please go and ask specifically, have you been vaccinated recently? Okay. छुट्टी पे जा रहे तो कहाँ जा रहे हैं? Have they gone abroad? Did they need to get vaccinated? Okay, please ask. I've written the remedies for post-vaccination. You have antimtat, silicea, thuja, and mesarium. See, there are many more, but then I've not written that because they don't cause fever. Torula does not cause fever. Okay, you're not going to give torula to a post-vaccination fever patient. You will think of antimtat, silicea, thuja, and mesarium. Okay, heat stroke. So in heat stroke, are we going to treat them? Normally, we'll say no, go back, rehydrate yourself, stay cool, and drink a lot of water, eat normal food, and rest. If it still does not get better, then we give natrum sulf. We have glonine, belladonna, all that. But then what are you going to give if there's fever? You can give natrum sulf if you're very sure it's a heat stroke. Radiation sickness, radium brome. Gout, urticaria urens. Okay. Who has done, okay, everyone, I can only see this thing, but then who has done predictive? Has anyone studied predictive homeopathy? Can you answer in the chat? Okay. 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 Okay, I'm getting an idea. Okay. So one nice thing that Dr. Vijayka taught was theory of acutes, okay? And it's not a final reading, but yes, there are certain points and aspects of it that I also use, and I think they're very nice, okay? Like we use the dull, active, then those who don't change, there's no change in them. They are still running, playing, doing everything, even though they have a fever. And we also have the dull ones. Then we have, in dull, we have even the drowsy ones. In the active ones, we will think whether they're physically restless or mentally restless. All these things really do matter. Huh? So the thirst, the thermals, it's a nice book to read. I would really recommend you all read Theory of Acutes by Dr. Vijayakar. But this is not a seminar of Dr. Vijayakar's. I think you can read that book separately. The idea is that that also gives indications of what remedies can come. If the person is dull, you're not going to give arsenic, because the person has to be mentally restless and not comfortable. If the person is just lying down, sleeping, they're totally different remedies, like gelsemium and bryonia. And then you have the ones who are, still doing their normal day-to-day functions. So then we think of Cilicia, Staphy, carcinosin. There are other remedies which don't complain, okay? Arnica, okay, which don't complain even though they had like having very, very high fever, okay? Then how fast did the symptoms develop? This is extremely important, because this is one of the things I always make sure I do, is see if the patient has come to me on day 1, day 2, or day 5. So if the patient has come to me saying, see, I have now got fever, headache in the morning, and doctor, I have come to you, now it's only 2 hours, but then I know that this headache will instantly go into fever in another, 1 hour, and then by night, I will be having 104. So then I know that this patient knows that this is his tendency. He has very fast acutes. So I will not try and give him calcarea or something like that. I will try giving a Merxol, or I'll try giving a fast-acting remedy. If there are patients who say, day before yesterday, we had some nice chole bhature outside, and we had pav bhaji, and it was very tasty. Today, we are having a stomach infection. Then the remedy is totally different. Then I might give arsenic album, because I know that arsenic album is meant for a slow poisoning. If it has happened today and they vomit today, then I might give a Nux Vomicum. So the prescription will change according to the instant reaction or the delayed reaction of the patient. The remedy and the potency has to match the patient at the pace of the disease. Okay. So in cause for fever or any acute, there are 2 causes always. One is a predisposing cause, like a cause which has happened, which was already there. I had diabetes, or I have a history of TB, or I always had a tendency to cold and cough. Every change of season I am having this, or every time I go in the sun I get a fever, or whatever. So there is a tendency, okay, which will be one of the things. And then there'll be one which is the immediate cause. I went out and then I got it. I ate this and then I got it. Someone insulted me and then I got a fever, or I got my results and then this happened to me. So there will be an instant cause, an immediate cause, and a predisposing cause. Both of these are important and will help us in prescribing for the fever, okay? Here, of course, we need to keep the constitution in mind, because if the patient is a Cilicia, okay, if a patient is a Cilicia, we know that they have a tendency to cold and cough. We know that they went out and we know that they got wet. Then I may not give Rustox at all to them. I may give Cilicia first.
I know पढ़ाई जाए वो है पण હવે કશું ના થઈ શકે हाँ बोलो
Please mute yourself.
हाँ आपको खुद करना है
Please mute
लिंक मैंने
yourself.
शेयर कर दिया आपके साथ कर लो
Excuse me. Whosoever is speaking, please mute yourself.
I can only see a smiling face of someone.
Okay. Not a problem, ma'am. Now you can continue. Yes.
Okay. So here just to make it less boring, I'm adding a few stories, okay, of some of the cases that I treated in COVID. And I'm sure these are, of course, learning cases. And maybe you'll be able to relate to it or understand how I got such nice results and how there were some very quick prescriptions I could do. Quick. I didn't need to do anything more than this. So if there was a family which came to me with COVID, and then the first person I treated, and I said, "Acha, theek hai, this patient will get better Dalkamara or Antimtat or whatever." And then afterwards, the next patient in the same family and the next patient in the same family, I would give them acid phos. Okay, because if they have been nursing the person who was sick and very anxious and worried and like, abhi kya hoga, abhi wo kaisa hoga, so these patients usually go into an acid phos state. Okay, so acid phos was my go-to remedy in COVID. It was there in my COVID kit, and one of the main remedies which we used to get over was acid phos. That time, cocculus was not the remedy. I know you will ask me all these questions, so I'm answering it. Why will cocculus not be the remedy? Are there anyone on the chat? Why will cocculus not be the remedy? Any answers? Okay. Okay. The answer is here. Mental worry. Okay. But where is the effect? The effect is COVID. It's respiratory. Okay. So if it is mental worry and the effect is in the chest, I will not think of cocculus because cocculus does not cover respiratory symptoms. That's why I told you in the beginning that when we are doing something where we are checking them, hum wo sab kar rahe hain na, systemic examination and all that, that has to have a reason. I'm not doing it to prescribe anything. Cocculus I would have given if the person had nausea, vomiting, the things we know cocculus for, chakkar aa raha hai, madam. So then I would think of cocculus. But here, since I was treating COVID, and since the action on the respiratory system is also equally important, I was giving acid phos. This was in my COVID kit. So here, what was it? Ailments from excessive grief, loss of vital fluid. Okay, chest troubles develop from brain fag, hoarseness, dry cough with tickling in the chest, salty expectoration, difficult expectoration, difficult respiration, weak feeling in the chest from talking, and pressure behind the sternum rendering difficult breathing. So we even had one patient, this rubric is in Fatak. Okay, so she said, "Doctor, only if I do this now, the cough doesn't come. I have to bend the neck and do this." She was an acid phos case during COVID, but she exactly did this. Bending the neck forward and sitting like this, then my cough doesn't come. If I sit straight, if I bend forward, if I do anything, then I'm coughing. I have to sit like this. So that's there in Fatak. I don't know. You'll have to look it up and see what the rubric is. But yes, that's what happened. So when the patients talk about exams, okay, and they have fever during exams, please don't stop at अच्छा उसको बुखार है and exams चल रहा है तो बुखार है तो उसको जल्दी से ठीक करना है. This is usually how the patient comes, na? Like the mother will say, "Doctor, ठीक होगा ना क्योंकि कल से exam है." They don't tell इसको exam है करके उसको बुखार आ रहा है. They will say ठीक होगा ना because after this they have the exams coming up. So stop the patient there. Ask them more details about it. What exactly is the fear? You will not only take anticipatory anxiety. It is not just anticipatory anxiety. So it might be because he's not sleeping. I had a picric acid case like this. They were studying so much. CA ka exam tha. They had not eaten, not gone out of the house for so many days. They were only sitting and studying and studying and studying and studying. And then they went into a fever. So please go into little more detail as to what exactly is happening in the house, what is the effect of it, and where exactly are they feeling it. So this patient who had picric acid had severe headache all the way back, all the down to the spine, till the coccyx. That would not be covered by argentum nitricum. So please don't stop at ailments from anticipatory anxiety. Please go into the details and correlate. This is the cause. The effect is here. The effect is in the brain and spine. The effect is not in the stomach. He's not having diarrhea or loose motion. Okay. So everything, if the patient has Silesia patient, the effect will be in a totally different set of sphere of action. So look at cause, look at pathology, look at symptoms. All three things together will give us the remedy. Okay. And this goes for other acutes too. Okay. So if you're treating something like metrorrhagia, I'm answering this because I was asked this, and I will go ahead and talk about it. But since the time permits, I will write this. Okay. So metrorrhagia or menorrhagia, find out every single thing. Is it a fibroid, or is it endometriosis, or is it a bleeding disorder? It does not always have to be the same thing. The remedy changes completely if it's fibroid, completely if it is PCOD. If it is thyroid, it is a different remedy altogether. If it is a bleeding tendency, it's different. Okay. We also have hysterical fevers of Moschus. I enjoy giving Moschus. Moschus is the best paying patients. They always have problems, and Moschus helps them. Okay. Any anxiety, any worry, anything, first they will come up with physical symptoms. Okay. Progress of disease. Here we are looking at, as I've mentioned this before, speed of the patient and speed of the disease and how to match it. Okay, they have to match. The remedy should also match the intensity. You cannot give Merxol where calcarea is indicated. Okay, you have to see the intensity. It might be ammonium carb that you might give, but you won't give Merxol. Okay, so you will have to look at the intensity and the speed of the disease. Okay, so by this stage of case evaluation, you know that what you're treating, and you are as per clinical science, and we have to have a fine idea of the type of fever we are dealing with, the possible differential diagnosis, and the organs involved. So this is exactly what I was saying. When you know, as I told you in the acid force case, that the effect of the worry and the effect of all that was on the chest. Okay, so we know the cause and we know the effect also. Okay. Okay, so location. Location is not just, location is not just, it's paining in my stomach. Okay, I will think, is this pain coming from the pancreas? Is it coming from the gallbladder? Is it the duct? Is it the gallbladder duct that I have to treat? Or is it the gallbladder itself I have to treat? What exactly do I want? What's the effect of the remedy that I want to create to cure the patient? Okay, so this location, when I'm saying, it is a very, very important point in treating acutes. Location is something where I will think whether it is the muscle or the insertion of the muscle or the bone near that muscle, or it is the anterior part of the bone, what exactly, or which nerve exactly. If it is nerve, is it the trigeminal nerve? Is it the vagus nerve? I am thinking anatomically, physiologically, pathologically at all times. I want you all to understand how I think, because that will help you prescribe. It is a little difficult because I think you all are used to hearing other speakers, and I'm not really sure how many speakers talk like this or think like this. And I don't know if it's getting too heavy for you all. Is it getting too heavy for you all? Can someone reply? Is it getting too heavy? Sure.
No, ma'am. Interesting.
Okay. If it's getting too heavy, please start asking questions. Huh? I'll know that you can't understand because I can't see anyone's face. So I still am not sure. Huh? Okay. Sensation. So when I think of sensation is one of my favorite things I ask the patient because, okay, I think you'll know that I've also done CCH and FCH and I've also been following Dr. Shankaran, and I know sensation and I've used sensation quite a bit. Okay. But here I am not talking about the sensation that Dr. Shankaran talks about. I am talking about sensation from a pathological point of view. Okay. So when I see sensation of the patient, I am thinking, for example, if the patient says colic pain, so I know it is an empty organ. Colic hai na? So it will be maybe the gallbladder or the gallbladder duct, or it'll be the intestine, or it'll be something that can twist and cramp up and close up. Okay. So I will know that this is not a muscular plane, ye hernia nahi hai, for example, or this is not ovaritis, or this is not whatever. Okay. If I know there is heaviness in this pain, then I know that the organ which has heaviness in the abdomen, which has heaviness, will be the liver. I know then it is not the intestine and the gallbladder. So every sensation that the patient is asking me also is making me analyze which part of the organ or which part of the, not just the remedy part, but exactly what. My diagnosis has to be more accurate than what an allopath will give, because an allopath might give cyclopam or meftal spas or give whatever, paracetamol, and they'll feel better. But for me, I know I need to know exactly what. Is it the liver? Is it the stomach? Is it the, what will give, what kind of pain will come with a lung issue? Nothing. There will be breathlessness. Maximum they'll have is heaviness. If there is pleural effusion and pleuritis, then there'll be stitching pain. So will I give bryonia to someone who does not have pain or someone who has pain? Obviously to someone who has pain, because where does bryonia affect you? In the pleural cavity. Are you getting where I'm coming from? I'm still wondering whether you all are getting it, but then okay. It's difficult doing webinars, huh? Okay. So when I'm reading, as I said, I'm thinking where exactly is it working and what exactly do I have to give in order to prescribe to this patient. Okay. Concomitants. Concomitants are something that give me the homeopathic remedies, as well as, again, it tells me which organ is affected. So if the organ that is affected, say if the patient is better by movement or better by in a particular position, or it's better, then I know that it is a skeletal-muscular affection. If the patient is better by pressure, then I know it is not musculoskeletal. So everything that is, when someone gives me, I am at all times thinking what exactly is happening inside. Okay. So here's this case I have put here, where I had a case of kissing tonsils, and it was full. It was full means it was as if there was cheese on top of it. Okay, they put a layer of cheese on top of it, and it was, means she could not open her throat, so I couldn't take a photo, but it was, the tonsils were like this. I was wondering how she can even drink, forget eat. Okay. And she was actually coming to me for PCOD, and she had amenorrhea, a young girl. I think she was around 13, 14 years old. Yeah, 8th, 9th standard. And she had not come for some time. She came with this throat complaint. And for some reason, I asked her, Acha, what happened about this? You have stopped coming for quite some time. Kya hua hai? So she said, yeah, since then I've got no menses. So when I connected the amenorrhea with the caseous tonsils, the kissing tonsils, the remedy I gave her was Laccan. And I cannot tell you everything got better. Her menses came back, her throat got better, her pimples went away. She started looking fairer. I don't know why. Means like it was, so when she started looking fairer, everyone asked her, where are you going? So I got a lot of patients after treating her for her throat. But the connection was the PCOD. So at all times, if you're treating a patient and the patient is coming to you with constitutional prescriptions, please think from that angle also. So what would be the remedies I think of for a sore throat with PCOD? Anyone has any clue? Chalo, interact. I will get bored and I'll stop. Okay. Baraita, lachesis. I told laccan. Okay, there are lots, okay? So there's ammonium moor. Merc IR. Okay, but I'm talking about something which has PCOD plus throat complaints, okay? Merc IR calm karega because there's kissing tonsils, but Baraita will also work, lachesis will also work. But I'm right now thinking of connecting two different pathologies, okay? We heard na metastasis of mumps to the ovaries. How do we see it? आपने पढ़ा ना कहीं तो भी? Yes, phytolacca will work, calcarea iode will work, pulsatilla will work. Very good, very nice. Okay, good. Okay. So ammonium moor is one remedy. Laccan is one. We have there's another very good remedy, laccan, and then there is if I'm not mistaken, it is monoria with throat pain. Yeah, laccan is there and calcarea iode is there, and there's another one. Yeah, phytolacca. Yes, lysine. I will tell you. There's another very nice remedy for this. Okay. So, anyways, here the patient got better with laccan, and as I'm telling you, it gave me a lot of references. So please, if you can get good results, your clinic will really do well. Modalities. So modalities can tell us many things. Apart from the organ involved, it can also differentiate and rule out remedies or rule in remedies. It can also direct us towards a group of remedies, though we must make sure we use the common symptom or modality for what it is, like to help in the clinical diagnosis of the fever. And modalities can be a position or an external stimulus like light, heat, noise, touch, weather factors, moon phases. So what I'm trying to say in modality is don't only look at that particular thing. Take a broad perspective. This is something I keep telling my assistant doctors also. Look at it from a broad angle. When I'm telling amenorrhea with throat, have I only taken the throat? No, I looked at it as the patient as a whole also. And look for it. It might be an acute in a chronic case. Okay. So in such cases, you're going to not only look at the acute as an acute. That's why I tell my assistant doctors, don't prescribe, because I don't know whether I want to prescribe SL. Why will I want to prescribe SL? If the patient is a patient of laccan now, like this, and the next time she comes with a throat complaint, will I give her? I won't, because I want the ovaries to get okay. And I know that will go from the ovaries to the throat and then come out. So the next time that the patient comes with a throat complaint, मैं SL देने वाली हूँ. Because it is a subacute or an acute on a chronic. So knowing when to prescribe and knowing when not to prescribe is also a part of a homeopathic journey. It is not what an allopath will even worry about. Okay. . So by now, I think we will also know what to see in the case and how to prescribe, because now we've understood the clinical diagnosis. We have also taken the ODP, the origin, duration and progress. We have also seen the LSCM, your location, cause, what do you say, sensation, modalities, and concomitants. And we have seen the cause, both of the causes. We have seen the predisposing cause and the trigger. Okay. By now we have done all this. Now we go into PQRS. Everyone knows what a PQRS is, but this is what I have to say about it. Okay. That please do not prescribe only on PQRS. It might guide us, it might anchor us, it might root us. But if you just see one PQRS and you prescribe and you have not seen the larger picture, you will not get results. It's impossible for you to get results only on PQRS. Unless that remedy covers that pathology and that particular state, and you have just got lucky. PQRS is only guiding. It is not confirmatory for prescription. Okay. So you have to make sure that you can confirm the remedy in all the things. So say, suppose, like I said, ailments from worry, cares and worries. We have so many remedies. But when I will give cocculus or when I will give acid force will depend on the state of the patient and whether that remedy covers that. So it will not only be ailments from this and then I give a remedy. No. Okay. States of fever. So this is another thing I learned from Dr. Dhanapkar, and it's there in the book where he writes about the states of fever and how to take microscopic details about the state of the fever. Now in this, if the patient comes to us in the heat stage, okay, or the chill stage, or the sweat stage, you know, have you seen lots of patients, they come, they say, doctor, we have taken paracetamol and now we have come. Yes, lots of them. Okay. So when we see patients who have said that, what are we supposed to look for? We have to look for what happens after the heat stage. Okay. So if it is thirst after heat, or perspiration after heat, or chill after heat, or bhook lagne lagi hai, yeah, they're getting nausea, heat stage after. So you don't stop there. And you ask them what happened before that. Before the fever came, what happened? Unusually well before fever, sorinum, right? So you are going to ask, bhook laga, khana khaya, fir bukhar aaya. We know the remedies, China or Briannia. We know so many remedies which are hungry before fever. Okay, so you're going to ask symptoms which are pertaining to a particular stage of the fever, and also the pattern. So is it, we know all these stages, but then we will be looking whether it's chill, heat, perspiration, or heat, chill, perspiration, or thirsty only during fevers, or thirstless during fevers, or whatever. So you're going to be looking at what exactly happens during that particular phase and the pattern that is developing. All this has remedies. And again, I'm talking about y'all, maybe most of your cases will get better with Briannia and Lustox and arsenic album. And mera bhi aisa hi hota hai. It's not that I don't do what y'all do. This is a little more advanced than that. So I'm sure I'm considering you all to be, you know, practitioners with at least 4-5 years of experience, so that maybe I'm able to relate to the children who are coming in, the new practitioners, and also the patients who are the doctors who are practicing for quite some time. Okay. Oh, many are senior. Okay. It's maybe okay. This is an interesting thing. So partial heat, we take now head hot, extremities cold, or head hot, hands cold, head hot, only head hot, and the rest, or head and hands are hot, and then the feet are cold. So these things are extremely important. So what I do with a fever patient is I usually touch them everywhere, and I see, are they sweating? Is it only on this side? Is it on the part lane? Is it on the upper part of the body or the lower part of the body? These things really help us in prescribing for fevers. They are very, very important. I don't know who else does this, but please start doing this. Dosage and repetition. Oh, I love this topic. So dosage and repetition. Dosage has to match the speed. The more the speed, the more the potency. Intensity and severity. If the patient is not suffering for many days and the patient has a very high intensity, please give high potencies. When I mean high, I mean 1M. Okay. When I mean medium, I mean 30-100. And when I mean low, I mean 60. Okay. Severity of the fever. The severity of the fever decides my frequency of prescription. Most of my prescriptions for fever is always in fractional doses. It's plusing potency. I make them mix it in water and take it regularly depending on the amount of times that have to be repeated. So I find water doses and plusing potency much more effective than a dry dose. If you see gross pathology, like if I had a case of pancreatitis and the patient's serum amylase levels were high, there was swelling, there was ascites, there was everything, and the patient had fever, and the sugar levels were obviously fluctuating because it was pancreatitis. In such cases, I go low because it is a pathological prescription also. So in pathological prescriptions, I will do 30, but I will give more repetitions. Maybe I will give it every 4 hours. Okay. Remedies for, okay, I'm hoping the patient is better now. I hope the fever has gone. And I hope the patient is now better because now we knew what to give. Remedies for post-fever states. Okay, so post-fever, these are the 4 remedies which are usually prescribed: influenzium, tube-aviar, avena sativa, and salicylic acid. I'm going to help you all differentiate this because we see a lot of these cases that come post-virals and then they come to us only for immunity. Yeah, getting better. They have not recovered. Okay, so these are our bread and butter. Influenzium is for weakness post-influenza. Tube-aviar will have very similar symptoms to tube. There's loss of weight, there is weakness, and usually there is respiratory weakness. The patient is having difficulty in breathing. Okay, they will have difficulty walking many steps. Yeah. Avena sativa will have loss of appetite, weakness, and sleeplessness. after fever. So Avena sativa will recover the patient from sleeplessness also, loss of appetite also, and weakness. But if you ask me, which one is stronger? Obviously, it will be tubavir. Moderate influenzium. The weakest in action will be Avena sativa. So if I'm giving it just like without worrying and just like, okay, something with the constitutional, I will give Avena sativa. I will not touch the other two unless it is really required. Okay. Salicylic acid is weakness or rheumatic pains after fever. And usually there will be a history of having paracetamol. So salicylic acid will remove the side effects of paracetamol. Or any antivenom, kuch bhi ho, aspirin ho, that will also get better with salicylic acid. Now, besides this, what are the other remedies we'll use post-fever state? Ailments from loss of vital fluid, right? China rahega. So there are other remedies which will come, but then you have to see that specific cause then. Okay. Another remedy, another way you can look for this is ailments from confinement. Have we seen this rubric? Okay. So pulsatilla, all those remedies will come as not better after fever, if the fever is prolonged. Okay. I don't know how much time do we have? 3:15. What do we do?
Ma'am, we have a lot of time still. If you allow, we can ask some questions which have been given to Dr. Krupali by many doctors.
ठीक है, तो मैं emergency remedies in homeopathy नहीं करूँ ना?
As you wish. If you want to continue with the emergency remedies, then you can continue. Otherwise, we can even have some questions with us.
तो क्या करूँ मैं, बोलो?
The viewers are saying, please do the emergency remedies.
But you cannot ask me questions, huh? Choose.
Now viewers has to decide, do you want emergency remedies that you have in the home?
ये भी और वो भी नहीं होगा. ठीक है, emergency
One
remedies.
is saying emergency remedies.
ठीक है. Okay, I'll try to do this fast so that we have time for some 1-2 questions, maybe. I don't know. Let's see.
Okay,
We'll try to do it patak se, huh?
yes.
ठीक है. So emergency is anything which is serious, unexpected, and dangerous and requires immediate action. Okay, these are a few life-saving drugs that I would see. This is something I have made, so I'm not saying this is like a hard and fast rule, but then please take everything with a pinch of salt and see what you want to do. Okay. These remedies are not curative. I want to say it. This is abhi ke liye itna karo aur fir bhago. Okay. Till you reach, while you're in the ambulance, I don't care, till the ambulance reaches. These remedies are ones that I want you to keep at home, but they are not curative. Okay. So these are supportive, and it's until the patient is hospitalized for radical supportive treatment, and in no way replaces hospitalization unless the clinician has wisdom and experience and skill to manage the case. Okay. I think you'll know this. Do we need to have a first aid kit? It's lovely to have it. First of all, everyone must be aware where the first aid kit is. You're not running around for it. So the first aid kit has to have a special designated place where everyone knows that this is where you're keeping it. Okay. If there's an emergency, they should know. Okay. It has to be first aid kits also are designed to treat non-emergency situations that do not need a doctor and can provide instant care in emergency situations. A kit can provide you with assurance that minor injuries can be dealt with in a quick manner. Okay. The contents in the kit have to always be monitored that they are not expiring. Okay, please. Expired ones have to be checked. You have to know exactly where you're keeping it. Keep it in places which are handy, like in your handbag, in the bathroom, in the car, in the kitchen. These are places where my cantharis is always in the kitchen. Okay, so you have to know where you're keeping it. Okay, breathing problems. So the digitalis of the lungs, it removes temporary obstruction of dyspnea, an effective remedy in many cases of asthma. It stimulates the respiratory centers and increases oxygen in the blood. Want for breath during exertion is the guiding symptom. Which remedy? Aspidosperma. Aspidosperma. Okay. Okay. Suspected heart attack, angina. What remedy will I give? What happens in suspected heart attack? Chest pain, discomfort, and you feel that your heart muscles are not getting enough blood. It may feel like pressure or heaviness, ache or squeezing in the chest. The pain may come to the shoulder, arm, neck, jaw, and back. So if a patient has toothache, but toothache with sweating, please think of angina. Okay? It may feel like a pressure, and it may feel like indigestion or nausea and cramps and numbness or faintness and pallor. It makes you sweat without exertion. So there's cold sweat on the face usually. Shortness of breath. It will increase when you're walking, climbing, exercising, or cleaning. And you feel kuch to bhi hone wala hai. There's a sensation of impending doom. Beautiful. All these remedies will work. Which one will you keep in the kit? Which one will you put in the kit? I will put amyl nitrate. Okay. So the first thing the patient has to do is not walk, relax. Ask someone else to make the phone calls, take them. Loosen your clothes and have amyl nitrate. Have it every, which potency? Which potency in amyl nitrate? Very nice, very nice, very nice. Okay, 6C. So I've told you for now 2 remedies. What was it? Aspidosperma, amyl nitrate. Please, if the patient has got CPR, what will you give? You'll know how to do CPR? I think you will get a recording. You will be able to read what I've written now.
Yes, ma'am. The recording will be available.
Okay. So I'm not repeating, huh?
Yes, ma'am. Yes, ma'am.
So this was amyl nitrate that we discussed. If you read it, you will see that it is very similar to what we talked about in suspected angina. Okay. Fainting. What will we do for fainting? So fainting, we'll look for causes. Cardiac, so you're going to check the pulse, okay? And you're going to check the pupils. You're going to check if there's a seizure, and you're going to check if the patient has a fruity breath in the mouth, okay? Okay. Yeah, you're going to check change of mental status, tone of muscle, and cardiac history, okay? What are you going to do? Raise the hands and legs. We prepared, the patient might vomit. So you're going to tilt the head to one side, assess the patient, rehydrate, open windows, reassure, keep tab on pulse and call for help. What are we going to give? It's not moving. Yeah. Okay, it's moving again. This is gone. It's gone back a bit. Here. Can you see? Remedies. Amyl nitrate. Aconite has anxiety, cocculysis with nausea, and Conaim for vestibular vertigo. So in Conaim's vertigo, they don't want to even turn the eyes. They want to keep the eyes closed. Even if they turn the pupils, then they get vertigo. Okay? These are the remedies for fainting. So till now, how many remedies have we given? Aspidosperma, amyl nitrate, and aconite, cocculus, and Conaim. Low BP, aconite if there's anxiety, followed by Natromur 6X or ferrum phos. I've seen some patients get better with Viscum album, and I've even seen patients get better with lachesis. But what I like doing is I like having remedies in the kit which I can interplay. Like if I have, then that remedy should come. इसके लिए भी फायदा में होना चाहिए, उसके लिए भी फायदा होना चाहिए. So because of that, I've not kept lachesis here. But then if you want to keep it, if you want to keep Viscum album, they also work effectively. Okay. Chain stroke breathing. Last stage of life, right? Do we know it? Chain stroke breathing. So there's rapid breathing, and then apnea, and then again rapid breathing, and then apnea, and we know that this patient may not survive. I have tried this so many times, and it's an amazing remedy, and I beg you all, please keep it with you all in your clinics, because you don't keep it otherwise. The remedy is, okay, this is what chain stroke breathing is, and the causes are written here. It is the hyperapneic period, where this beginning is, the breathing is slow, and then there's the amplitude of respiration increases. Gradually it reaches a maximum, then it decreases and reaches a minimum. Then it's followed by apnea. This effect is called waxing and waning of breathing. The apneic period is when the force of breathing is reduced to minimum. Stoppage of breathing occurs for a short period. Then this is followed by hyperapneic stage, and this thing keeps going on. Carbo-veg. Okay, now what I've written here is what is written in Kent. Okay, but which potency? Laurocirrhosis. Yes, laurocirrhosis works, but that is for pulmonary hypertension, and yeah, it will not work on the respiratory centers. Huh? Which potency of carbo-veg? Chalo, the person is dying. The patient is almost dead. Please go for the high potencies, 10M, 50M, CM. This has to be in the emergency kit. Okay, carbo-veg, 10M, 50M or CM. Seizures, belladonna. First thing you can give. Of course, after that, you are supposed to take the acute of the seizures, and then whether you want to give Secuta or absinthium or cupromet or whatever, that will be seen later. But in your kit, belladonna is good enough. Okay, which potency? 1M. Allergic reactions. Histamine 200. I'm going fast, huh? severe bleeding, menstrual piles or expectorations or anything, any very severe bleeding. So these are remedies that are there: Epicac, Hamamelis, Trillium, Sabina. Sabina would be the one remedy you can have, or Epicac you can have in your kit, because this kit, if it's in the car, it'll help you for car sickness also. So I would say that you keep Epicac with you. It works beautifully for gastric bleeding, respiratory bleeding, anything where there is arterial bleeding, Epicac will work. Hamamelis will be venous bleeding, which is usually not an acute case. I've written lots, but then these are remedies for emergencies in the clinic. Like if I've picked up a case of TB, then I will be giving these remedies as in my kit for the TB patient. This will not be in the emergency at home. Choking, I think you'll know Heimlich's maneuver. Drowning, it's not in our scope. Starts acting funny in between. Burns. Chemical burns, usually they'll happen because of an acid. So the best will be to put a base, okay, an alkaline solution like baking soda. So that removes the acid from there. So again, as I said, look here, again, I'm saying this. The cause is so important. You don't say burns and then you think cantharis. The cause of the burn, see, everywhere the cause is very, very important. So the cause, if it's chemical, you're going to look at putting baking soda on it, okay? If it is thermal, if the cause is heat, then whether it's wet, dry, or electrical, the severity or the depth and the location, okay? If it is superficial and only on the skin, then it is urtica urens, okay? So because I'm saying only on the skin, then what will I think of? I think of sunburns, okay? So then I will think of urtica urens. If it is deeper and there's severe pain, there's vesicle formation, then I will think of cantharis. If it is deeper than that, and it is a 3rd degree burn and it's gone right inside and it has burnt up the nerves also, and there's no pain with the burn, then, and I know that this particular burn injury can lead to a stricture, then the remedy is causticum. So superficial will be urtica urens, a little deeper will be cantharis, and very deep will be causticum. A nice way to remember it is, you know the dowry burns, where the person douses themselves with kerosene or whatever, and then they set themselves on fire because they are very upset and angry or don't want to live anymore because of the way they are being treated. These are causticum burns. The mental state is also causticum. Anger, indignation, insult. Okay. And the physical state is also causticum. Dowry burns, the one remedy is causticum. You must try it, and please share your cases if you ever get them in your clinic. This is for me as a disclaimer. Contact the hospital of burns if there is anything that is larger than the size of your palm. If it is a chemical burn, if there's oil burns, and if there's burn on the face, hands, eyes, ears, feet, or perineum, then they should go to the hospital. Electrical burns, I've treated some beautiful cases of electrical burns. There are 3 remedies. The first remedy of choice will be phosphorus, carboanimalis, and morphine. Electrical burns. Yeah, I think I've done everything. Arnika, you know, head injuries. It should be in your kit. Mental emergencies. Suicidal impulse, anxiety, panic, attack due to failure or bad news. Aconite. This is a remedy you should have. Intolerable pains that drive him crazy and he wants to kill himself because he cannot tolerate the pains is also. Yeah. What? Okay. तो देखो हेड इंजरी का बहुत सारे रेमडीज है. ओके, सो यू कैन हैव सिक्यूटा, नाट्रम सल्फ, कोनाइम, बहुत सारे हैं. But again, that is a different topic, and that is when we are treating the case as a chronic, that they have a history of head injury, and then the patient comes to us, and then we see what is the effect of the head injury. That is when I will decide whether I'm giving natrum sulf or Secuta or arnica or whatever. Okay, so that it's a beautiful remedy for head injury. I use it a lot. Okay, but again, if it has to be in my emergency kit, I will think of arnica. Okay. This is not an emergency. And I think they need 2 slaps instead of alcohol, instead of Natsomica. Excess alcohol or drug intake. Diarrhea and vomiting was the first drug of choice. If you all don't answer this, I'm not going to answer your questions. Okay, thank you. Yes, please keep arsenic album in your kits. It's the best. All my patients know. They call me only when arsenic doesn't work. I don't answer their call until arsenic has been taken, and yet they're not better. So yes, arsenic album is the drug of choice. Okay, if you can see here again, I've mentioned, I don't know why I'm teaching so much, because this is again diarrhea and vomiting. So they can be causes which are allergic, infectious, or non-infectious. Okay, but again, in our kit, we are going to keep arsenic album. Hiccups. Any remedy for hiccups? ये तो किट में रहना चाहिए. No one is going to come to a clinic for hiccups, huh? So it's best in the kit. Okay, very good. Very nice. Very nice. Yes, hyoscyamus works beautifully. Yes. Yes. Okay. So hyoscyamus and kaju puttam. Thirty potency before you ask me. Pain in abdomen. See, pain in abdomen now usually you should not take. And you should know that you're not supposed to give a painkiller for pain in abdomen. If it is appendicitis and by chance your pain in abdomen goes because you have given medicine to reduce the pain in the abdomen, you have actually induced, or you have been part to the fact that there'll be a rupture of the appendix. Okay, so pain in abdomen, please do not prescribe on the phone. Pain in the abdomen has to be examined, confirmed that it is not appendicitis, and then you treat. Okay. So these are the things that you're going to not treat. Pain that lasts for more than 6 hours or which is getting worse. If the pain stops when the patient starts eating, if the pain does not allow the patient to eat, if there has been more than 4 vomitings, if the pain is worse on movement, if the pain starts from all over but it settles in the right lower abdomen, if the pain wakes the patient at night, please do not pick up these cases. Please, I'm requesting you. These are what you should not pick up. If the patient is pregnant or thinks she's pregnant, if the pain in the abdomen is very severe with fever, if there is pain with inability to urinate or pass stools, I'm talking about acute pain. I'm not talking about simple little bit of pain here and there. If the patient says, this pain is different from what I normally feel, please, please, please make sure that you understand what is happening there. If the patient faints in pain, if the patient sweats in pain also, please, please check the patient. If the pain is coming from the testes, these are cases you do not treat at home. Please refer them out. Toothache, as I've mentioned, if the toothache is accompanied with cold sweat, please know that is angina. Don't treat it. Give amyl nitrate and send them. Okay. Now, so I was talking about all these emergencies, and I wanted to share this side of the emergencies. Okay. So we've seen emergencies with all the remedies for your Shane stroke breathing and your respiratory distress and your epileptic fever, seizures and your fever and your vomiting and diarrhea. And we have seen so many emergencies. Okay. See belladonna. Can you see belladonna? It's an excellent remedy for angina. Violent palpitations, reverberating the head with labored breathing, palpitation from least exertion, throbbing all through the body. Dicrotism means the pulse is in 2 beats. Heart seems too large, rapid but weakened pulse. So that means if you don't have amyl nitrate, you can still give belladonna. Even in Shane stroke breathing, if you have nothing, you can still give belladonna. Foreign body, where we taught Heimlich's maneuver, there also belladonna is indicated. Even in angina, it is indicated. Even in epileptic seizures, it is indicated. Even in hiccups, it is indicated. Anxiety and panic attacks, you can still give belladonna. So belladonna would have worked in all these cases of emergency. So this should be there in your kit. And if nothing else, belladonna should be there in everyone's home. Okay. So belladonna has 11 special centers of action. One is the CNS. Then there's the circulation, temperature, pneumogastric nerve, muscles of hollow viscera, kidneys, generative organs, skin, eye, and mucous membrane. As in when you'll start studying and you'll go deeper into homeopathy, this is one thing we do to understand the pathophysiology of a drug. Go back to poisoning cases, go back to the cases which had accidental overdose, and we study those cases and improve our materia medica from there. Okay. We have how much more time?
We have 10 more minutes, ma'am.
10.
10 minutes. Okay. So what do you want me to do? Answer what you all asked?
Yes, ma'am.
Well, there are a few questions over here, as
Okay.
I have shared with you. But if you
So
want to take few of them,
you've sent me this list. Should I answer this first? Or
okay.
I don't know, you tell me.
Yes, ma'am. Continue with that.
How you integrate other systems of medicine with homeopathy and homeopathy with allopathy. Now, I always integrate. I feel that it is just the way we tend to not think well about allopath, some people, but no, that's not true. Everyone, when we entered BHMS and took admission in BHMS, or when we took admission in allopathy, we did not intend to do anything besides treat patients and give our life in, and sacrifice our life for service for humanity. Okay, so I if you ask me, all schools of medicine have been started with a good intent. Okay, I use allopathy for all kinds of my patients who are on treatment for hypertension, diabetes, or Parkinson's, or thyroid. I don't stop their treatment. I don't. If they get better, then I will taper it down. But no, I don't stop anyone's treatment unless I feel that that medicine is causing a lot of side effects and we can do without it. But if that's not the case, I will not stop. And in fact, I am one of the patients who always refers my patients to other allopaths for help in diagnosis or for further investigations. So I feel that it's very important for us as homeopaths to integrate ourselves for a higher cause. At the end, we want the same result. We want the patient to get better. How do you administer our medicines in hospitalized patients with Ryle's tube or on ventilator with oxygen mask and comatose patients? I make, first of all, the patients that are there, I usually give it in plusing potency. So usually we'll put a drop of the medicated this thing into water, and then we rub it on their pulse points, pair pe, haath pe. If possible, we put it for them to inhale or smell it. But we put it on maximum part of the body. I had a very difficult case which had at the end stage of the patient's life, they had lymphedema, and they had been put putties of Epsom salt to reduce the swelling. So that time it had become very difficult for us to medicate the patient. So at that time also we were medicating them on the upper chest and around the face. Okay, so just look for open skin and apply the the water, medicated water. Okay. Frequency and repetition really depends on the state, because in hospital administered cases, you don't want the patient to die. Okay, so when the susceptibility is very low, so you have to really be very, very careful. Remedies which are, how can I say, very potent, we give in low potencies, but at the same time, there are desperate times called for desperate measures. So I have gone up to giving by pyrogen in CM, antimtart in CM, aspodosperma in 10M, mercsinate I've given in CM, 10M. So it really depends. I'm not scared of giving high potencies. I'm not at all scared of giving it, and I can give it in repeated doses. I can give pyrogen 10M every, I don't know, 1 hour. I do that, and I've seen results with that. But again, it really depends on how we our confidence, and we have to know, like if we're giving something which is where the patient is really not doing well or their vitality is very low, you have to go low, ekdam low, like 6C also, 6C or 6X. I've given even those kind of low potencies. Role of homeopathy in hypertension, and can we stop ongoing allopathic antihypertensive drugs? Role of homeopathy in hypertension, we are excellent for anxiety patients. So if a patient is supposed to be taking anxiolytics in their hypertensive medicines, our MDs work much better and can control that kind of blood pressure much better than a allopath can. But when there is hypertrophy of the heart, if there's cardiac hypertrophy because of uncontrolled hypertension, in those kind of cases, please do not try to treat it with homeopathy. Please give your antihypertensives. Make sure that the patient's hypertension is really under control. We don't have medicines which will reduce the systolic only or reduce the diastolic only. Nahi, hamare paas nahi hai waisa. So please don't try doing all that. Okay. Give the allopathic medicine, treat them constitutionally, treat them miasmatically. Automatically, their regular normal blood pressure will slowly come down, and we can very slowly taper down the antihypertensives. This is not supposed to be done in a drastic way because that is overconfidence. In acute cases, how to make totality of symptoms on basis of symptoms of disease or generality of the person physical. Okay, I think I've given you the whole seminar on this, but yes, you have to look at totality of symptoms, but then you don't look at it blindly. Okay, you look at the cause, you look at the pathophysiology behind it, and then you look at the constitution. I've treated in the past 1 month, I treated 2 cases of jaundice, which came to me as acutes. One needed Nux vomica, one needed sepia. Both have been prescribed mentally. Okay, but both of sepia and Nux vomica, you cannot tell me does not cover jaundice. Okay, so my ultimate prescription is really totally based on their physical generals and their mentals and all that, but I am making sure that whatever they are suffering from is also covered by the remedy involved. Okay, then scope of oral very good. We have excellent results with oral lichen planus, but then that is another topic altogether. Some scope and idea regarding acute emergencies in obstetric cases like atonic uterus, contracted OS, oligohydramnios. I treat all these cases. All these cases are treatable by homeopathy. We can treat atonic uterus, contracted os, oligohydramnios. I think if you're following my Instagram, you all will know I treated oligohydramnios with helonius. We even have remedies like carcinosin, pituitarin, which are very good for, and of course, a lot of anti-miasmatics. Even medoranum works beautifully for oligohydramnios. Contracted os, the remedies pituitarin. Atonic uterus, the remedy cyclamen. Chalo yaar, you all know all this. Bas. Okay, I'm not going in this. I had actually done a beautiful more on how I prescribe acutes with tongue, but then I don't think I have the time for it. So now I will answer whatever else you all want me to ask. Tell me.
There are few questions in the chat box.
I've answered. Lichen planus, I've answered.
Okay.
Low potencies, I've answered. Give seminar in Vadodara.
Yes, they are asking to come. You come at Baroda and have this wonderful session. And if the people
I will come to eat.
We can arrange if everyone agrees, we can arrange at Ahmedabad or Vadodara for everyone, if you agree as well.
We will connect for this. Okay, I'm not
Yes,
really
sure.
My timetable is, my schedule is extremely
Sure,
right.
ma'am. Anytime, if you are very comfortable, let us know. We can arrange a seminar in Ahmedabad.
हम एक काम करते हैं, those of you who are here right now, we'll keep a special study circle for that right now. Okay, sure, so that y'all can y'all can maybe ask me. But seminar in Dodra will be, we'll plan it. We'll plan it. I'll
Yes,
see when I can do it.
yes, ma'am.
I wish I knew before, then मैं run off cut से उधर आ जाती.
Sure, ma'am. Ma'am, one more question is there. There is a protocol also for thyroid cases. How and when to say that the patient you do not need further medications, especially for hypothyroidic cases, and follow-up needs to be done along with investigation once reports are normal. So there is no recurrence happening.
Every 6 months. Every 6 months you have to do the test. Bus.
When you declare that the patient
3
does not-
months they should be thyroid normal, and then you can declare the patient as normal.
Okay. So one more question. Okay. Just a minute. Jyoti Rao madam is saying if you anyone want to join with their group as well. Okay. One more question was there. Medicated water with low potency, dilution or mother tincture. What we have to give?
But it depends on the case, no dear. Abhi kal I gave 60. क्या दिया था? So it really depends. Yesterday I had a case of pancreatitis, and the patient was getting better with Epicac, but then afterwards they started having a lot of severe pain. So I gave them iris versicolor and 6C. Now iris versicolor mother tincture also works very good for migraines. So it really depends on what you're treating and what is the effect you want. So if you wanted to work on a dynamic level, you will not going to give mother tincture. Mother tincture will not work at all.
Yes.
Mother tincture is not for dynamic cases. Of course, some doctors will disagree. Like I think recently in the studies circle, I prescribed calendula to one patient of deafness, right?
Yes.
Yeah. So that was a case of deafness, because these are known cases. These are known. The Dr. Sarkar gives certain remedies which work beautifully in mother tincture. But these are particularly for those disease states, and particularly those mother tinctures. So I would not be able to generalize that and tell you, acha, theek hai, ye. No, otherwise best don't give mother tincture, give 6C.
Okay.
That will be better than mother tincture if you're not sure. Okay, if you're sure then of what you're doing, then you, according to that, you can change your prescription.
Ma'am, one more question. Is there any medicines for the work stress or lichen planus in our pathy?
I've treated so many cases of lichen planus. It's very, 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 very easily treatable. But again, usme to, you have to go into the mental state. You have to treat the mentals. So I will not be able to tell you a remedy that, okay, this remedy is very good for lichen planus. Nahi hai aisa dawai. No. This is because you have to go into the mental state.
Does any case of fever comes in the stage of aconite, like very acutely the patient comes to you or not? What's
So
your
if the patient has come to me in the first 24 hours, it's aconite.
okay?
Wait. Ailments from exposure to cold.
That is required, right?
Haan.
Okay. If same patient with same complaint gone to 10 different homeopaths, then 10 different remedies according to individual doctors, why? Which is the right one? How to decide?
Don't worry so much. Just give SL. One of those remedies which the other 10 different hospitals have given will work. You don't give SL. Don't give SL. Don't add to the confusion. Give SL.
Right. So here we ends with the questionnaires, ma'am. And thank you so much, ma'am, for this wonderful session. I personally and we team personally learned a lot today from your session. And now I request Dr. Krupali to have a thanking note for the ma'am. Yes, Dr.
Yeah. Before winding up, let me tell you something about our association, ma'am, the Homeopathic Medical Association of India. We are the largest registered homeopaths of this country, and is the only organization having such a big number of registered practitioners. And we are running ladies wing in that. All over India, we are running ladies wing. And we all are selflessly giving service to the HMI. So it's just for knowledge, as in Pune, you all are very good, very nicely united and working together. So if you are willing to participate in HMI, and be a member, then it will be privilege for us. So this is it. Yeah. And thank you so much, ma'am. Acute is such like we homeopaths can show our efficacy, and you are fully justified to it, and giving so many horizons how we can treat and how we are able to manage in all the stages of acute. So thank you so much, ma'am. And sorry for being a little opportunistic, but it is for our lady homeopaths who really want to learn and want to practice, even though from home, if they are able to treat at least their family members or neighbors,
Yes, very true.
our our
Very true, very true. Very true.
yeah, our efforts are such. So thank you so much, ma'am, for that. Thank you so
My
much. Looking
pleasure.
forward for many such
I want to end with a few things.
Yes, ma'am.
I will be doing a webinar on potency in the first week of July. Okay. And I also can send, for those who want to get the book of Acutes of Dr. Dhanapkar, if they want it, they can connect with me and I can send it across. And they can even join my study circle. It will be very nice. Yes,
I've already joined.
good, really good. So because it'll be easier for us to connect over there, or if you all want me to be there for y'all in a different study circle, that's also fine. I want y'all to please fill up the feedback form which I have for the present webinar, so that I also, like y'all, I get to know how I can improve and what is the requirement of the students today of this age, so that I can also have more targeted answers. And also, if I know my audience well, I will be able to change my teaching according to the level of the student in front of me. Yeah. So please help me also progress, help me grow. Please fill up the form. Tell me how you all felt. What were the things that you all felt missing? What were the things you all learned? And what else how else can I help you? Okay.
Ma'am,
This is from my side.
from a few words for the upcoming new homeopaths. If you want to give some motivating words to such newcomers about homeopathy.
So motivating words for new homeopaths. First of all, I can tell you there's lots of money here.
That's very practical.
Sachi mein, really. But what are we doing this for? There are two things. One is we want to do it and we want to, we love helping and we want to, but we do want to earn too, So there have to be, so right now, from what I have seen when I see doctors everywhere, is that we really have an edge, okay? There is a market for so many things that only homeopathy can treat. If you are really consistent in studying, there is a huge opportunity and huge market. All of us can have 1 lakh each, and yet there'll be less doctors. Okay, so there's a huge market for patients, for diseases we can treat. There is a lot of success waiting for you if you study hard and if you keep consistently practicing. For girls, I request, please do not close your clinics. You can get married, you can have babies, you can do everything and still run a clinic. Okay, so that would be my one thing for you all. Since you're ladies, I would suggest that you all just keep thoda na ho, even if it is a few patients, but please keep consistency. That's the only secret to being a successful female homeopath. The only secret to it is consistent effort towards homeopathy.
That's so practical and very approachable, ma'am. I would request everyone to on your camera so that we can have a picture with Dr. Ma'am.
Yes. I also want to see who I've taught.
Please on your camera for a few seconds so that I can have a picture. Please, it's a request. Please on your camera for a second. So here we ends up our session. Thanks a lot, ma'am, for giving so much time to us for practical approach to a case. Even the emergency kit was very amazing because a lot of people will be helped with whatever you have taught with the emergency kit. Even to the patient, it would be very helpful if we give such emergency kit to our patients. It would be very easy for the call consultations whenever they need.
I want you all to really earn money. If I am there, I'm serious. This is something I'm telling from the bottom of my heart. If there's any way that I can help you all to make your clinics run, I will be the happiest that I see gully mein homeopathic clinic. I will be the happiest person.
Yes, ma'am. So, and whosoever have joined later on or who have missed the session, don't worry. This session will be available on my channel. We'll post almost after 1 or 2 days because I have some function tomorrow. So I will post it by Monday or Tuesday on my channel. So you can again see the same session again and again and learn more and more. If you have not put down the you have not done the homework with like notes whatever ma'am has given, you have a chance again to see the same again and again, how many times you want to see. So that's all for today, and definitely we are going to try to call ma'am to Ahmedabad or Vadodara. If she is comfortable, definitely we'll call her and have a great session with her in her mind. Thank you so much, everyone.
Thank you so much. Thank you so much.
Thank you.
Okay, bye. Thank you.
Bye-bye.
Thank you, all of you. Bye.